Hi, Ms. Teresa Kaplan and everyone at Jacinto Nursing and Rehabilitation Center and everyone at Public Health. I'm the liaison, and I think, yeah, how are you, everyone? Hi, Teresa.
Hello there. I got my crew here.
Yeah, I'm so glad to see you all. Yeah, thank you for joining.
Thank you for having us.
Yeah, it's good to see you.
We also have David, who is the team lead for the team. David, would you like to introduce yourself?
Well, good afternoon, everybody. Thank you guys for joining us in this rainy day in Houston.
Thank you. I see Karis is back. We still cannot hear you, Karis. I guess I can proceed, and whenever you are back, then we can do an introduction then. Is that okay, Karis? Okay, perfect. Thank you. So welcome to the town hall. The goal for this town hall is to go over long COVID and monkeypox, as we mentioned earlier. But before we do that, I just wanted to take a quick moment and go through the reporting process. So if your facility, Teresa, Jacinto Nursing and Rehabilitation, if you all have any cases, please make sure you report them in a line list format and CC our liaison, which is Tanya Wahid. In addition to that, we have other resources that we as a team can provide at Harris County Public Health. You could have future town halls. We also offer assessments, on-site PCR testing, and vaccination clinics if you haven't already taken advantage of for those resources as well. So the focus of today's presentation, we are going to go over some risk factors for long COVID, common symptoms, health impacts. We'll also be covering resources and recommendations. On the monkeypox side, we are also going to go through disease transmission, overview of monkeypox, treatment, signs and symptoms, some guidance, reporting procedures, and our recommendations for that. Towards the end of the presentation, we will be going over some of our community outreach resources. And in addition to that, we will have a separate QA section. So if you have any questions, feel free to post it in the chat, or you could wait till the end, whatever makes it comfortable for you. So what is long COVID? And for starters, long COVID can also be listed as long haul COVID. It has various names. It's also known as post-acute COVID-19, PASC, post-acute sequelae of SARS-CoV-2 infection, long-term effects of COVID, and chronic COVID. So in the literature, or people surrounding you may list it in various ways. It's all and the same thing. You could also address it one of the other ways. Going back to the definition of what long COVID is, it can be any symptom or health issue that persists or develops for 4 weeks or more after the initial infection of SARS-CoV-2. This is the CDC definition. There are various other organizations who are probably using slightly different definitions, such as the World Health Organization that considers long COVID post 12 weeks. And we have the National Institute of Health, basically looking at definitions between 4 weeks, over 4 weeks to 12 weeks, and over 12 weeks. For our purposes through this presentation, we will stick to the 4-week definition by the CDC. So there can be varied different complications that you may see that may occur in the post-COVID phase and may go longer, up to a year or longer than a year. Anyone who has COVID can get long COVID, irrespective of the fact whether you got vaccinated or whether you were asymptomatic or if it was a mild case. What is the prevalence of long COVID? There was a survey conducted, which is known as the Household Pulse Survey, and the timeline of the survey was July 27th through August 8th of 2022. The prevalence of long COVID, according to that survey, is that a third of those who were infected with COVID-19 actually had long COVID. In addition to that, about 15% of all US adults had developed long COVID. So the first statistics right there could include pediatrics, but the second one on the list is strictly limited to people 18 and older. Prevalence estimates change widely between 5 to 50%. So we have one particular organization who is primarily strictly looking at the metrics for long COVID. As you see on top, we have PASC listed, which is post-acute sequelae of COVID-19. Just looking at the rates in Texas, over 2 million people around Texas have been affected by long COVID. And here are the national averages. So over 7 million people or cases in total all over United States. Among those 7 million cases, over 2 million had COVID. In addition to that, let's look at Harris County and our county numbers. The green line right here is basically looking at the survivors of COVID-19, and the orange line right here is basically looking at the cumulative numbers for PAC, which is long COVID. And the statistics, as you can see, for people who are surviving with long COVID is little less than 500,000 currently. So these are the current statistics that I was able to pull today, like 15 minutes ago. In addition to that, these are the daily rates of long COVID. So as I mentioned earlier, the green line here, it's mentioning that close to 100,000 or 750,000 cases on this particular day in January who were identified with COVID. We have less than 50,000 cases with long COVID, and the numbers steadily change depending on the statistics of people being infected with COVID over a period of time. So how do you diagnose it? There's not a single diagnostic test for long COVID. Individuals may have varied symptoms over a period of time, and this may be hard to explain and manage. Diagnosis has to be made by various clinical or physical examinations and looking through the clinical history by various professionals, healthcare professionals in general. So the clinical evaluation could use a combination of blood tests. We may have chest x-rays, we may have echocardiogram, and all of those combined would be able to determine if that individual would qualify for long COVID. In addition to that, in July of 2021, according to the Americans with Disabilities Act, which is ADA, long COVID is actually now classified as a disability. So what are the risk factors of long COVID? There are varied risk factors for long COVID. One is increasing age. So as a person gets older, there are changes with the immune system, and that may be one of the major factors. In addition to that, having gender as a female, or if that individual was admitted or hospitalized due to COVID or had severe COVID-19 illness, if that individual chose not to get vaccinated, or if they had any pre-existing underlying health conditions. The common symptoms based on the research article we looked at, most of these people, close to 60% identified with long COVID, had fatigue. That is one of the things that takes a very long time to resolve as well. Individuals also reported headaches, difficulty paying attention. Many individuals reported hair loss, 25% of them, and many were still suffering with shortness of breath. In addition to that, we will be going into various details about organ systems in future slides, where we can discuss how it's impacting the various organ systems in the body. So with long COVID or the severity of COVID, many individuals have also experienced autoimmune disorders where your body cannot identify themselves as their own, but it's listed as or felt as an outside agent, so the body attacks itself. In addition to that, there are many multi-organ effects that can be involved for the purposes of fighting the disease, or I guess progressing through the phases of long COVID. And in addition to that, there are many organ systems that may be involved, or individuals may develop new conditions such as diabetes, hypertension, or other neurological conditions. So talking about the impacts of long COVID, there have been an increased incidence of cardiovascular issues with individuals even 12 months after they had gotten infected with SARS-CoV-2. There have been inflammatory conditions such as myocarditis or pericarditis, which is primarily an inflammatory response for the muscle of the heart or the surrounding film of the heart. People have reported cerebrovascular issues, so that could include stroke or TIAs when the body starts building clots, and those clots are the ones that are thrown into various organs of the body, and wherever it lodges, that is the organ that gives you trouble. For example, if it lodges in the heart, it can give you a heart attack, or in the brain, that would be a stroke. Dysrhythmias are also common. So when we talk about dysrhythmias, we have AFib and ventricular arrhythmia that have been commonly noted with long COVID. There are many individuals who've had heart attacks or cardiac arrest that could be a very huge cause, like huge cause of death and mortality due to COVID. And then thrombotic disorders, just like we mentioned earlier. Individuals can be diagnosed with pulmonary embolism or deep vein thrombosis, depending on where the clot lodges. For respiratory complications, individuals have noted shortness of breath and chest tightness, and many have had a lingering cough even past the 1 month period after recovering from COVID. For many individuals, COVID-19 affects both lungs, and when it does, it's considered pretty severe. It has been noted in about 14% of the cases. 20 to 30% of critically ill patients also develop blood clots, just like we mentioned in the previous slide, and it can be very life-threatening if it is linked to the heart and the lung as a combination. The infection can also damage the wall and lining of the air sacs, and that can be very dangerous because it can lead to various complications. So in this particular slide, we have 6 images to your right. As you can see, the very first one right here is the healthy lung. But B through F is basically showing you the changes in the lung structure depending on the severity of COVID. The second one right here is basically showing mild respiratory symptoms. We are seeing excessive respiratory symptoms here because there are more damages that are seen in the lung model. This is when the individual is suspected with COVID-19. In particular, this is from a person who was 56 years old. This particular image, that is image D, is from a person who had severe COVID, in particular ARDS, which is acute respiratory distress syndrome. And this particular image right here has the skeletal structure with the lung, which is basically showing you that if an individual is to have respiratory distress and has damaging effects on the lung, since the lungs are protected by the rib cage, depending on the amount of inflammation, they may have difficulty breathing because there's not enough space for the lungs to expand to accommodate for that. And finally, you have image F, which is basically showing you the image of deep damage to the lung and fibrosis to the lung. So if there is scarring and fibrosis to the lung, it may be harder for the lung to, I guess, recover in a timely fashion causing more damage and prolonged recovery period. Talking about neurological complications, it could lead to nerve damage. Depending on the location of the nerve damage, there are individuals who are experiencing cognitive impairment, brain fog. There are individuals who are experiencing headaches, sleeping problems. So insomnia has been common after COVID, lightheadedness has been common. Because it's vascular related, pins and needle sensation and numbness is common that may be related to peripheral neuropathy. And for some individuals, they have also experienced loss of taste and smell. In regards to the GI symptoms, we went ahead and we divided it into upper GI and lower GI symptoms. For the upper GI, since it's related to the upper half of the body, we have nausea, vomiting, that's pretty common, loss of appetite, difficulty swallowing, and heartburn. For the lower GI symptoms, we have constipation, diarrhea, irritable bowel syndrome, or bowel incontinence. There have been individuals who have experienced mental health complications. This has become pretty common after COVID. So 10 to 30% of the individual or cases have experienced mental health issues, which includes PTSD. And just like we mentioned, sleep problems earlier, insomnia as a part of it, agitation, social isolation, and loss of interest. That could also be a contributing factor because of fatigue and how they have been feeling. Other issues that have been noticed include anxiety, diagnosis of clinical depression, brain fog, severe fatigue, nightmares, and emotional distress. So what are the treatment options? So depending on the stage of long COVID and the diagnosis, there may be multiple options that are available to the public. The very first one on the list is physical and occupational therapy. This is basically going to help individuals with severe long COVID to be able to acquire their or be able to perform their activities of daily living. If they are unable to perform a certain task, then the focus is going to be to go back and retrain them to get that particular task going. Olfactory training is going to help individuals if they have lost their sense of taste and smell, which takes a while to get back. Depending on the neurological damage or neurocognitive functioning, we may be in a situation where individuals may be provided hyperbaric oxygen therapy, which probably boosts the cells and provides them the oxygen needed to perform their activities of daily living. It also helps with their lungs, because if an individual is not being able to have a healthy exchange of carbon dioxide and oxygen, then this would be helpful in that phase to help them breathe. Finally, we have antivirals. So it has been known that if we are able to treat COVID in a timely fashion, the prevalence of long COVID and the disease severity is drastically reduced. So if an individual is to be diagnosed with COVID, we have Paxlovid, Remdesivir, and Molnupiravir as medications. The drug of choice is Paxlovid. It is an oral medication. Remdesivir is an IV drug which has to be administered by a healthcare professional. So these two are the drugs of choice. If an individual is to need medication or monoclonal antibody, we have that as an option as well. So we have some recommendations and resources. If you are to identify an individual who has experienced symptoms over 4 weeks, it's important to report to your liaison. We have Tanya for the facility at the moment, who is the liaison. Please make sure you are reporting the COVID-19 related hospitalization and deaths to your liaison as well. And in regards to the resident socialization and visitation policies, there are certain things we may want to keep in mind. Mask use is recommended. It's important to maintain the 6 feet for social distancing. Hand hygiene is also extremely important for the prevention of COVID-19. In addition, it's important to get vaccinated. If you need, Harris County we can set up a vaccine clinic through Harris County, and some of our employees could go to the center and provide vaccination or boosters to the individuals who need to be up to date with the boosters. In addition to that, finally, one final thing you could do is improving ventilation in the facility. So opening of the windows or doors for proper ventilation, and also using HEPA filters. We do have certain resources here, and after this presentation, we will be sharing the slideshow with you guys. We have the Inspire study dashboard. This is basically data published by the CDC. Enrollment in this began in early December 2020, and it's probably giving you the rates of individuals who were affected by COVID. And the data that's being collected here is over 3, 6, 9, and 12-month period, depending on the organ system that has been affected through COVID. We also have other resources here, which is basically looking at an overview of post-COVID information that your facility could use in the long run, and this is primarily for healthcare providers. If an individual is looking at long COVID as a disability, then we have a link for that as well. If you have any family members caring for individuals with long COVID, that is another link through the CDC. And we also have a link for the COVID clinics. And finally, in addition to this, if you have any questions or would like to reach the call center for vaccines and testing, you could reach out to them directly. But if you need assistance setting up the clinics, then in that situation, Tanya should be able to help you out. And our next section of the presentation is primarily looking at monkeypox. Karis, are you there?
Yes, can you hear me?
Yes.
Awesome, okay. So good afternoon, everyone. My name is Karis Cease. I'm an infectious disease epi here at Harris County Public Health, and I'm going to review monkeypox with you all. Next slide, please. Okay, we're going to briefly go over what's happening globally with monkeypox. So at this time, we are having a total of over 44,000 cases globally of monkeypox. And the grand majority of those cases are taking place in locations that have not historically reported monkeypox. About 44,116 of those cases out of the 44,500. In the United States, we've been seeing about 16,000 cases. And on a local level, Texas, mind you, this data is from earlier in this week. Texas had about 1,300 cases. 455 of those cases were in Harris County, while 376 were in the city of Houston, and 79 of those cases were outside of the city of Houston, but Harris County. This slide just shows you an age distribution of the monkeypox cases that have been reported in Texas. As you can see, we only have a few cases that were under the age of 18 and over the age of 60, with the grand majority of the cases falling between the ages of 18 and 59. So just to give some basic facts about monkeypox, it is caused by a virus, the orthopox virus. It's in the same family as smallpox. It's a variola virus, and this is different from chickenpox. So I know we hear pox, we see spots, and we may think they're related, but it's in the family of smallpox, not related to the chickenpox. As it relates to severity, monkeypox has similar symptoms to smallpox, but it's more mild. Also, monkeypox is rarely fatal, although it can be painful. And children under 8 and people who have certain skin conditions such as eczema are at risk of developing more severe rash. The incubation period for monkeypox usually lasts 7 to 14 days, but can range anywhere from 5 to 21 days. And it's important to know that monkeypox illness can start out looking similar to cold or flu, which can be followed by the rash. The rash will typically begin 5 days after symptom onset, and this is self-limiting, meaning that it doesn't normally require treatment, and the illness can last anywhere from 2 to 4 weeks. Let's talk about transmission of monkeypox. So monkeypox is spread through direct contact with infectious rash, scabs, or bodily fluids. So exposure to respiratory secretions for a prolonged period of time. And examples of this can be intimate contact, such as touching, kissing, sex. Also through sharing food and beverages, sharing straws, sharing cups, sharing objects that have previously touched infectious rash or bodily fluids. And examples of that can be linens, sheets, towels, furniture. And another way it can be spread is through pregnant people from the pregnant person to their fetus through the placenta. So at this time, person-to-person contact is driving our current pandemic. It is, you are able to get monkeypox from infected animals, and this happens through being scratched or bitten by an animal, or having or consuming animal products or products such as lotions. A very important thing to note is that monkeypox is only spread when someone is when somebody is symptomatic, excuse me, and that's when that person-to-person contact is taking place. Preparing for monkeypox. So monkeypox can spread to anyone who has that close person direct skin-to-skin contact, and by touching contaminated items such as utensils, bedding, linen, furniture, as previously mentioned. So we're thinking, like you see in these images, sharing drinks or food, sharing linen that has been shared with somebody who may have had a rash, and of course, that direct skin-to-skin contact with someone who is experiencing symptoms. Monkeypox readiness in your facilities. So listed are some steps that you can do in order to prepare for monkeypox cases. So as of right now, you should be having operations as normal, having standard precautions, and preparing for cases who may develop monkeypox or suspicious rashes. Stay up to date with CDC guidance. Of course, as things progress, CDC will update their recommendations, and there are just materials and resources you can use on their website. It's important to educate your residents, visitors, and staff on what to look out for monkeypox and what they can expect if you do suspect a monkeypox case. Identify private spaces that you can use to assess those who have monkeypox or you're suspecting of monkeypox. Another step would be to ensure you have adequate PPE, and that includes your mask, your gowns, and your gloves. And like I said, making sure you're having standard hygiene, standard precautions, the proper disinfection practices, and developing plans for disinfection using the EPA list. And of course, just knowing who to contact and who to work with at your local health department. Treatment options. So as we mentioned, monkeypox is a self-limiting disease, but if you do determine that you have a resident or patient who is in need of treatment, at this time that it can only take place by coordinating with your local health department and through the approval with the state. So if you are seeking treatment, the next step would be to reach out to your local health department so we can get that process started. At this time, TPOXX is the treatment that is being administered through the CDC. It's an approved antiviral medication for smallpox and other orthopox viruses in children and adults, and it can be given orally or through the IV. At this time, administration is being prioritized, and it's for those who develop severe disease, those that are at risk of developing severe disease, and that includes those who are immunocompromised, some pediatric patients, and pregnant women, those who are breastfeeding, and those who have one or more complications, and individuals who may have unusual displays of monkeypox. Once again, if a healthcare provider is believing that their patient falls in this criteria and they're seeking treatment, they should reach out to their local health department to start those next steps. There are other treatment options, such as the Cytofovir and the other options listed below. Vaccines. So at this time, there are 2 vaccines that are being offered. The main one that everyone is talking about is JYNNEOS. It's approved by the FDA for the prevention of smallpox and monkeypox viruses in adults at least 18 years old. Thanks to the expanded access investigational new drug protocol, there's broader availability of JYNNEOS, and that can be administered to the pediatric population. This vaccine is normally administered in 2 doses that are given to 4 weeks apart. The other vaccine is ACAM 2000. It's approved by the FDA for immunization against smallpox in adults at least 18 years old. It's a live replication virus, and it does have significant side effects. It's risky for those who are immunocompromised, and it's only approved for adults. So at this time, I'm going to go over some monkeypox symptoms. As I mentioned, monkeypox in its early stages can resemble cold or flu. So that would include fever, headache, muscle aches, fatigue, and then rash. So as people are developing a rash, we have pictures on the right hand of the screen that just give you a visual of what a monkeypox rash will look like as it develops. It's important to know that there are individuals who may have just one bump or a lot of bumps. So that's just something to note. If you pay attention on the right hand of the screen, you'd see what a vesicle would look like compared to a small pustule, the umbilicated pustule, and eventually to scabbing and the scab falling off in a monkeypox patient. So some of the questions we may ask in order to describe what you see on the right hand side of the screen about the lesions is if they're deep-seated and profound. So does it feel like it's digging into your skin, or is it poking out? Is it umbilicated? Does the center of it look like a belly button? So if you see in image C, that is what we're describing by umbilicated pustule. And like we said, we'll ask if it looks like a belly button, is it poking out? So those are just visuals to help you identify different stages of the lesions in monkeypox. This is just a more detailed description of what those different lesions are. A macule would be a flat lesion. It may have some color change. It's up to 1 centimeter versus a papule, which would be elevated and solid. Once again, up to 1 centimeter. A vesicle, we saw that in the previous slide. It's elevated and it's fluid filled compared to the pustule, which once again is elevated, but it has purulent fluid, meaning that the fluid may be more thick, may be a yellowish or white color. And then you'll have the scabbing. It will be crust on the scabs. So we can go to the next slide. Thank you. So those who are at higher risk and the high risk group for monkeypox as far as health conditions include those who have eczema, certain skin conditions that are exfoliative, and immunocompromising conditions. As I know we're dealing with monkeypox, but it's also important for us to think of other illnesses which may also resemble monkeypox, and just keep in mind some of those risk factors that are associated with monkeypox, and make sure we're ruling out other conditions. So we see an image of chickenpox, another image of hand, foot, and mouth disease, which is common in children, especially if they're in a daycare or childcare setting. There's an image of measles and scabies, which may be in some community settings. So these also allergic reactions, dermatitis, and other immunocompromising conditions are all conditions that may cause rash. So it's important to make sure that we're considering them when looking into monkeypox as well. What to do if someone is symptomatic. So if you are suspecting someone of monkeypox and they're symptomatic, it's important to immediately and discreetly separate them from the group. So when we talked about preparing a private room for examination, so separate them, make sure you're wearing your appropriate PPE, such as the gloves, the gowns, and mask, and make sure you're avoiding skin-to-skin contact with them and their contaminated clothing. We're going to have the person follow up with a doctor for medical evaluation. If the person has monkeypox, they should continue to isolate until they are recovered. And that would mean that their scabs have completely fallen off and new skin is developing. And you're going to contact your health department for guidance and next steps. We can also help make sure that their contacts have received the appropriate post-exposure prophylaxis or PEP, also PP. We're going to close the room and areas off so that they can have clean, so that you're cleaning and disinfecting areas that they visited. So we don't want to have transmission, and we don't want to make sure others are being contaminated. So we're going to make sure they're isolated and clean areas that they may have been in. You're also going to make sure you're wearing masks and gloves when handling items. We're going to use EPA List Q in order to find disinfectants for emerging viral pathogens. If blankets and mats are shared, we're going to make sure that they are appropriately laundered. And if you can't launder them, they should be discarded. If using a vacuum for cleaning, make sure you're using a mask and a vacuum with a HEPA filter or a wet vacuum. You can notify family members or next of kin. And if you need assistance, we can provide you with letters to assist in that process. As mentioned, you can work with your local health department in order to report a monkeypox case and receive guidance and assistance. This slide shows your point of contact information for our health department along with other health departments in the area. So this goes into a little bit more detail if once you're suspecting someone of monkeypox, if they are indeed positive. Once again, they should be under isolation until they're fully recovered, which once again means scabs have fallen off and new skin has started to develop. We're going to avoid the sharing of bedding, personal items, furniture, food. We're going to make sure that they are wearing a well-fitting disposable mask because we do know there's a respiratory component of monkeypox. We're going to cover any skin lesions with long pants or bandages or sheets or gowns to avoid direct contact or contamination. And we're going to make sure that they have space dedicated solely to them unless you have other monkeypox cases. And in that event, they can cohort together in the same room. If you have a staff or volunteer that tests positive for monkeypox, they should stay home and isolate until fully recovered. exposed individuals or contacts. So those that have been exposed to monkeypox should be monitored for that 21-day incubation period. And you should do contact tracing. So once you're monitoring them, of course, look out for flu and cold-like symptoms and then that rash. So this just lists some precautions that you want to take. When entering isolation areas, staff should be making sure they're wearing gowns, gloves, eye protectants, and NIOSH approved respirators. Laundry, when handling dirty laundry for suspect or probable or confirmed monkeypox cases, residents should wear gowns, gloves, eye protection when handling that material. And cleaning and disinfection. Once again, staff doing this should be using the proper PPE and they should be using the proper disinfectants, which once again would be found on that EPA list Q. Waste management. So handling, storage, and treatment of patient dressing should be handled in accordance to the U.S. Department of Transportation's hazardous materials regulations. So once again, if you're having an outbreak, you want to make sure that you are properly handling the waste, and it's category B. So you can visit the website linked. You will receive these slides just to receive a little bit more guidance concerning the storage and handling of disposable waste. And this slide lists just some resources that that you could find useful. You will receive the slides, and if you have any questions, we are here to help you.
Just a second. Jasmine, are you on call?
Hi, everyone. Good afternoon. My name is Jasmine. I'm the Resilience and Recovery Specialist for our Harris County COVID division. So first, I want to thank Epi for that great presentation on long COVID and monkeypox. It's really great information for everybody and especially the community right now. So thank you for that. So community resilience, what is community resilience? It's the ability to use, for the community to use its own assets and to strengthen the public health and healthcare systems, to improve the community's overall physical and behavioral social health, to withstand and recover from adversity. So what that means is we want to make sure that we're providing information to you all, so you guys can provide information to your own community and make sure you're using your own resources, like Harris County Public Health, City of Houston, any other resources that the community may have, so we can withstand any adversity like COVID or monkeypox. How do we get this done? We work closely with you all, the community partners. If you have any questions, like Harris mentioned, we are here to assist. We do still have our COVID testing sites and vaccination sites, and we will continue to share information with our outreach team as well. And we will continue to do these town halls just so we can make sure that we're giving proper information on long COVID, COVID overall, any new vaccination that gets approved, and monkeypox, anything new on monkeypox as well. So I'm just going to hand it over to Kemi. She's going to be talking a little bit about health equity. And like I said, we're here to assist you all with any questions that you may have.
Hi, everyone. Thank you, Jasmine, and everyone else who went. You guys did a wonderful job. So I just wanted to touch really quickly before we end on health equity and what it is and how that is part of the goal when we talk about vaccination and we talk about testing as well. So health equity is described as an effort where everyone has the opportunity to achieve their full health potential. And so one of the things that my role does in health equity, and Jasmine's role as well, we make sure that we are part of the planning and the strategy when it comes to reaching out to the community. And so we've had a vaccine partner incentive program where we gave out gift cards to the community for COVID vaccines last year. And then we also give out resources such as the testing kits, the at-home testing kits. We gave them out to some selected partners. We also make sure that we're part of diverse messaging so that images can reflect the community and the language as well. And another key part of health equity is making sure that we are going from transactional to not doing transactional, but doing transformative relationships. And so not necessarily a give and take, but making sure that we can interact with our community members and see how we can help them in any way possible and connect them to the resources as well. Also building relationships is also important. And then lastly, using data. We use data to help us inform where we can be in the community, specifically when it comes to testing and vaccines. And so our goal is to increase testing and vaccination rates in areas that are considered testing deserts or that have low reports of vaccination. And this is based on zip code data. And so these locations have include locations that have limited access to healthcare and testing resources, or sometimes we call them COVID-19 hotspots. And it informs us to know where there's a need for testing and other resources within the community. So we do partner with faith-based organizations as well as other schools and other organizations as well to kind of help that. And so based on this data, we know that these communities possibly live in under-resourced areas. And these are Black, Indigenous, and people of color that are mostly affected. And so these communities are a focus for our health equity strategies. And even right now, currently, we still have testing and vaccination available. And we still like to reach out to partners to see if they'd be interested in doing testing events or vaccination events. And now that we're rolling out with the monkeypox vaccines too, we are still looking to partner with organizations that would be willing to host us and have a great community turnout for the people who are eligible for the monkeypox vaccine. And so that's it from me. And if you have any questions for Jasmine and I on community health, resilience, or health equity, then definitely feel free to let us know.
Thank you so much. Does anyone have any questions? Jasmine and Kemi, would you mind putting your emails in the chat as well? So everybody has a copy of those emails. I'm just looking to the chat to make sure all the questions are answered. So the very first question I see in the list that was sent to me is for Karis. Give me just a second. Can monkeypox look like shingles in regards to the symptoms? Karis, are you on call?
Hi, yes, I'm still here. So as it looks, would it look like shingles? It mostly, so if somebody is having lesions and bumps, then yes, it can look similar. For shingles, if people are having rash, possibly, but yes, if somebody is having any of those flu-like symptoms and lesions, then yes.
Thank you. I think that was the only question that we saw in the chat. Does anyone else have any questions? Teresa, would you have questions for us?
No, everything was very informative. My team was very impressed of the information. Thank you, guys.
Thank you so much. That's all what we have on our end. If nobody has any questions, I guess we can wrap up for the day. I'm going to send a copy of the recording. I'll have Tanya email it to you, Teresa, and we'll share the copy of the PowerPoint as well. In future, if you have any questions for us, please let us know.
Looks like
Okay,
there's
thank you.
something in the chat. Someone has posted some questions in the chat.
Okay, I probably overlooked that. Give me just a second. Okay, give me a second. The rash can, okay. I'm gonna go back. Give me a second. Why have the presumptive cases that have been reported in the news conclude to be presumptive? Laura, is that question in regards to monkeypox or long COVID? Would you mind asking your question here? Because, okay, monkeypox. Karis, this one is also for you.
Yes, so when we're using the word presumptive, it's kind of epi-criteria and classification terms. So for monkeypox, as we mentioned, there's the orthopox viruses, and monkeypox is not the only orthopox virus. So if a doctor or lab runs a orthopox test, since monkeypox is really the only orthopox virus currently circulating, we would presume that it's monkeypox. However, there's an additional test that specifically is testing for monkeypox virus, which is one of the orthopox viruses. If that test is used and comes back positive, we would then label that as a confirmed test.
Thank you, Karis.
You're welcome.
There are no other questions in the chat. Does anyone else have any other questions while we are here as a team? Are there any other forms of therapy to restore neurological or cognitive impairments in long COVID? Hyperbaric therapy was one that we discussed during this presentation, but depending on the type of impairment that that individual has experienced during the process of long COVID, there may be other treatments that may be plausible depending on what is prescribed by the physician who is treating the case. Does that answer your question, Bryce?
Yeah, it does. I just had a brief question. I thought that was interesting. So thank you.
Thank you. Other questions? Okay. Thank you so very much for joining. I appreciate you all taking time during the busy day to join for this particular town hall, and hopefully we will be in touch. Thank you, guys.
Thank you.